For several months, this was my workplace. Every morning, I'd get up and I'd walk through this gate into Nyakabali Hospital in a very rural area of Uganda. Walking through this gate changed my life, and it brought me to where I am today. Here in this area of Uganda, malnutrition was so common among children that it wasn't even viewed as a health condition. It was just seen as part of the way that children grow up. But we know that if it's left untreated, malnutrition has serious consequences. And worldwide, a child dies of malnutrition every 6 seconds. We know that every single one of these deaths is preventable. So we worked with hospital staff to set up a malnutrition treatment center at the hospital to try to avoid these preventable deaths. One of the first patients that came into the clinic was Ronnie. When his parents brought him in, Ronnie was so weak and malnourished that he could hardly move, and his parents didn't think he'd survive even a few more days. The nurses started him on an infant feeding program, and he started to gain weight, and he was discharged from the hospital within a few weeks. So a few months later, we walked through the villages to visit Ronnie and his family to see how he was doing. And we brought along rations of plumpy nut, a therapeutic food to keep him continuing on his treatment outside of the hospital. When we did a health assessment of Ronnie, we saw that he still did have signs of malnutrition, but that he was absolutely on the path to recovery, and he'd completely turned around from just a few weeks earlier. This experience changed my course. It was absolutely heart-wrenching seeing children so young lose their lives in the hospital, knowing that each one of those deaths could have been prevented. And I knew that there were thousands of children like Ronnie out there who might not have a chance at a healthy childhood. But the success we saw in children like Ronnie was inspiring and empowering. And from that experience, I learned that I wanted to pursue a career in public health. So that brought me to the Australian National University, where I've been doing population health research focused on improving the health and well-being of Aboriginal and Torres Strait Islander children. So before I go any further, I'd just like to pause to acknowledge the traditional owners of the land on which we meet, the Ngunnawal people, and I'd like to pay my respect to elders past, present, and future. I'd like to acknowledge all Aboriginal and Torres Strait Islander people who are with us today. And I'd also like to take a moment to recognize my colleague and friend, Ray Lovett, who's contributed to the ideas that I'll be speaking about today. Each colour here represents a distinct Aboriginal or Torres Strait Islander nation, each with their own unique and distinct cultures and languages. Many of these languages are still spoken today, and these cultures are among the oldest continuing cultures in the world. But these strengths aren't what we hear about in the media today. So today I'll be talking to you about how we currently report on Aboriginal health and well-being, how we define success, and what we might do instead. So when you think about Aboriginal health, the first thing that probably comes to mind is closing the gap. You might think of all the areas in which we see deficits, shortfalls, and gaps in Aboriginal health compared to the non-Indigenous population. And that's what we hear in the news, that's what's always in the media, and what we tend to hear seems to always be about the negatives. And so some researchers went out and tested this. So they analysed media articles about Aboriginal health to see how many were talking about Aboriginal health in a positive way, a negative way, or neutral. So what they found is probably no surprise. Overwhelmingly, what we hear in the media about Aboriginal health is negative. More than 3/4 of the stories focus on Aboriginal health in a negative way. Only 15% highlighted any positive elements of Aboriginal health. So what does it matter? What does it matter that we keep hearing about these negatives in the media? First, this perpetuates negative stereotypes about Aboriginal and Torres Strait Islander people, and this can fuel discrimination and racist behaviours. Second, Aboriginal people can lose self-esteem and can have negative impacts to the social and emotional well-being from always hearing about their people told about in a negative way. They might start to feel shame about being Aboriginal based on the way that it's portrayed in the media and what this means. Both of these can then impact negatively on factors that we know protect our health. If you're afraid of experiencing discrimination, you might avoid accessing a health service. Or if you do go to the health service, you may be treated unfairly and not receive recommended treatment. Or maybe as a coping strategy to deal with your stress and your experiences of racism, maybe you smoke or use alcohol. So that in turn, all of these factors then lead to poorer health outcomes. So this constant focus on the negatives and the gaps only serves to make these gaps wider and to perpetuate this inequality. So when we think about the closing the gap strategy, we define success as when Aboriginal health matches that of the non-Indigenous population. This is undeniably an important goal and something to work towards. But this shouldn't be the only way that we define success. We could just define success as a time in which we see improvement in Aboriginal health and well-being without looking and focusing on this comparison first. So I'll go through 2 examples of when this goal of closing the gap doesn't actually align with this overarching goal of health improvement. So this graph shows a gap that closes over time. If you look in the 1990s, the gap between the 2 lines is bigger than the gap is in the 2000s. So when we take a closing the gap frame, we see this as success. We see that we're working towards closing this gap. But what if I told you that this gap was showing the prevalence of gestational diabetes among Aboriginal mothers and non-Indigenous mothers? Then is this really what success looks like? What this graph shows us is that both Aboriginal mothers and non-Indigenous mothers are getting worse off. We see that the gap's closing over time, but that's only because the health of non-Indigenous mothers is getting worse more quickly than the health of Aboriginal mothers. So in relative terms, we see that the gap is closing, but in absolute terms, both groups are worse off. So to me, this is certainly not what success looks like. So let's try another example. This graph shows the prevalence of smoking among Aboriginal adults and the total Australian population in 1994, 2004, and 2014. So we can see that the prevalence of smoking has dropped from over 50% in 1994 down to about 40% in 2014 for our Aboriginal adults. In the total Australian population, smoking's dropped from about 30% down to 15%. When we focus on the gap between these lines, we see that it hasn't changed much over the past 2 decades. At each of these 3 time points, the prevalence of smoking is about 25% higher among Aboriginal adults. So when we look at this in terms of closing the gap, we might say that there's been little, if any, progress made. But what if we told this story a different way? What if rather than focusing on the gap, we focused on the health of our Aboriginal and Torres Strait Islander Australians? What if we take away the gap and we take away the comparison? Then what we see is a 14% prevalence reduction of smoking among Aboriginal adults. What this means is that there's 50,000 fewer Aboriginal smokers today than there would have been if the prevalence stayed the same. So what this means is that tens of thousands of through this smoking reduction. So to me, that's what success looks like. When we focus on the gaps, when we focus on the inequalities, we lose sight of the people that these statistics represent. When all we do is look at the gap, we lose sight of these 10,000s of lives that have been saved. So of course, there's often times where it's valuable and important to compare populations, and there's absolutely value in the Closing the Gap campaign. These comparisons and benchmarks help us to see how things are going, to see areas where we might need extra work, and to see where things are going well. But this shouldn't be the only way we define success. And this shouldn't be the only side of the story that we hear. We shouldn't only hear these negatives in the media. We should be looking and listening to positive stories of progress and success, and valuing these stories. So today I challenge you to question the negatives and the comparisons you hear. I challenge you to find the other side to that story. I challenge you to find what strengths and successes might have been left out of the story that you're hearing. So to me, the goal is not to improve the health of one population relative to the other. To me, the goal is to improve health, full stop. So to bring us back to the beginning, at the end of my time in Uganda, there was a knock at the door of the hospital. This time it was Ronnie and his family. They'd come to visit us. Ronnie was walking and talking and smiling. This time, rather than us bringing Ronnie his therapeutic food, Ronnie's family had brought us a basket of food from their own very limited supply to thank the hospital for changing Ronnie's life. To me, this is what success looks like. Ronnie's success shouldn't be discounted compared to other children who might be doing better, and his progress shouldn't be forgotten about just because malnutrition is still common in his community. To me, Ronnie's progress and any other health improvement is something to be celebrated.